Hello, Mr. Smith. My name is Tenny John-Idiagbonya. I'm your provider today, and I learned that you here for complaints of feeling depressed, not feeling like yourself for the past couple of weeks, and you also reported having some suicidal ideation, having hearing voices, and based on the symptoms, the presentations that you have, we have decided that I'm going to start you on olazapine, and I'll just explain to you what olazapine is and how it's going to help you. Feel free to ask me questions. I will explain, and we're going to walk with you through this process. Olazapine is a second generation atypical antipsychotic medication. This means that it's a medication that is used to treat schizophrenia and bipolar disorder. The generic name is Zyprexa, and it's described as atypical because there are certain side effects, that neurological side effects that are not very prominent with it. So, and that is part of the reason why I'm choosing Zyprexa for you. Another name that is also called is Zyprexa Zidis type. So another type of the medication. They have the tablet forms, the tablet that is non-dissolvable. Then we have the oral dissolvable disintegrating tablets that is called the Zyprexa Zidis. That is easy to just put in the mouth and it dissolves. So, and it's a small tablet. The size is pretty small. So you mentioned that you don't like to take medication, so it will be easy for you to take this because it dissolves easily and it's very small in the size that you have it, as you can see in the picture. It also has the Zyprexa Reperver, the intramuscular injection type that is used. We will not be using that for you because your condition is such that we can manage at this point. We're going to initiate therapy. It's the first time that you're taking this medication, so we're going to initiate therapy slowly with you. And we will start at 5 milligram PO, that is by mouth, HS, once a day in the evening. The tablet comes from 2.5 to 20 milligram. The oral disintegrating tablet also comes from 5 milligram, 10, 15 to 20. We will be using that oral disintegrating tablet for you, like I said, and we'll start at 5 milligram. You're going to take 5 milligram for the first week. The office will call you, and let me let you know now the office is going to call you in about 2-3 days and to just check with you to see how you are doing, since it's your first time of taking this medication. And then in a week's time, we're going to schedule for you to come back for reevaluation to determine if we need to go up on this medication, or if we need to continue with you on that level. It's easy to this medication is easy to see improvement with this medication. It has a lot of benefits. I will share with you now how this medication works. Is basically it helps to provide serotonin and dopamine in your in the brain, the supply, because it blocks their reabsorption. So basically, it enables their availability and thereby improving the symptoms. Okay, it helps to improve your symptoms, and it helps to improve symptoms of mood, your thinking, and also your behavior. So those are some of the things that we will be looking out for, and it is easy to. It's not so expensive. It's pretty reasonable, the price, compared to other atypical antipsychotic medication that are in that category. Um, the price is reasonable, and it helps with the promotion of improving positive and negative symptoms. It will help your appetite, and I noticed that you have lost from what you reported, that you lost a great amount of weight in the past couple of months because you were having pretty much the symptoms that support isolating yourself. You were not eating right, and you dropped a significant amount of weight. Now, this medication will also, it will help with your appetite. The only thing is we'll just keep a close eye in monitoring how fast that happens. Like I said, this medication on label use, we will be using it. It's used for schizophrenia and bipolar disorder, bipolar depression, and also treatment of um, resistant depression. And you do know the bipolar, the mania, and the depression are the symptoms we see. So it helps with this mood, to balance the mood, and this it does with the brain, in the brain, by the balance in making available serotonin and dopamine. Those two, it's neurotransmitters are the ones that it works with in the brain. Now, the side effects includes akathisia, which is like something like restless leg syndrome, amnesia, forgetfulness, back pain, constipation, dizziness, dryness of mouth, hypertriglyceridemia, which is high triglyceride. Most of the symptoms that is listed here, they are more common with higher doses, and we are starting at 5 milligram, and we will progress very slowly if need be. Otherwise, we will monitor you over a period of time on very minimal dose, but we will also be watching out for the symptoms. Insomnia, that is inability to sleep, can sometimes also occur. Orthostatic hypotension is one of the symptoms, so you want to get up slowly, change position slowly, not suddenly. If you notice peripheral edema, any drowsiness, somnolence, you want to let us know immediately. It increases your appetite, which is a very big plus, which is the reason why we are actually recommending this, because again, of the significant weight loss that you have experienced, as you reported. Though the weight loss with the weight gain, we have to monitor, because it can be associated also with metabolic side effects due to the weight gain that you experience. So we're going to keep monitoring and checking you, working closely with you to make sure that you are within the norm. Um, all, like I told you, it does help appetite. So this is a medication, olanzapine, that is also used because of how it works. It is used for anorexic people that are not eating, um, anxiety disorder, cluster headache. It helps to manage that. Even major depressive disorder, obsessive compulsive disorder, and post-traumatic disorder, stress disorder. It helps with all of that also. Will not be at this point. We want to stabilize you with this medication. We want to balance your mood. We want to balance your thinking process, your behavior, so everything kind of stabilizes, and also to bring you to a place where your weight, don't weigh your self-esteem, just take it one day and at a time, and allow the medication to take its course. We want you to feel better, to get better. This drug does interact with some medications. You have told me you are not on all of them, as I shared with you, including zyprexa, because it has cardiac issues that it can create. But you have verified that you are not on those medications, and you are also not on lorazepam. We'll try not to take it with lorazepam because it increases your drowsiness. We don't want you to be drowsy, Mr. Smith. So we want you to be alert and function safely and well. This medication, we don't encourage it for elderly people, people that have suicide risk, or people that have seizure risk or history. And also, you can't use it. Please, you cannot use the drug with alcohol and or smoking. Pregnant women can use the drug if we're able to establish the benefits over if it outweighs the risk. It's okay for pregnant or breastfeeding mothers to use the medication. It is that safe. It doesn't have significant side effects that is worrisome. Though the black box warning for this medication, remember I told you that we don't encourage it to be used for elderly people. And this is because this medication, for elderly people that have dementia related psychosis, it can result to delirium and sedation syndrome in them. So that is the black box warning, that we don't encourage its use for such patients. We choose other preference for them so they don't have that syndrome problem to deal with. And the lab work that I will be ordering today, um, not today, well, we will do today to, at least to have a baseline. We're going to do just a complete metabolic panel, your CBC with DIF, thyroid. We'll check your liver function and your lipid functions. They are okay from your previous lab work that we have done. Actually, your urinalysis also is fine. Now you will be checking your blood glucose, and with time, when you come in you're going to come in a week's time, and then you will come again in 2 weeks time. Then we will do some of this blood work and continue to check you routinely to make sure that your numbers are your body is working well with the medication. That is solely the goal for these checks. If you have any question for me, do you, Mr. Smith? Okay, I'm assuming, okay, you understand all what I've explained to you. So if you have any questions, please feel free to call my office or send me an email, and I will respond immediately. Within 24 hours, myself or my office will respond to your questions, any questions you have for us. Thank you, Mr. Smith, and we'll walk through this process and hope you feel better. Thanks.